You guys need a break, huh? Hi, everyone. My name is Kareem, CEO. I'm co-founder of Mendel Health, and I'm also a physician. Last year, in March, I lost a patient to brain cancer, and just a week later, I find out about a breakthrough treatment that would have saved his life. I just didn't get to know about this on time. Now, when I joined med school, I joined it to save lives. But this patient's story is not a one-time thing. It's something that happens every week, even worse sometimes every day. Now, is that only me? Well, MD Anderson, the world's #1 cancer center, did a research on their own patients' pool. And they find out that 40% of their patients never get to access world-class treatments that you would expect them to get just due to the lack of awareness of the doctor. I repeat, the lack of awareness of the doctor. Now imagine if someone ends up in some rural area. Imagine if someone is even overseas. This can't just be the case. But we already know that doctors are really smart. They want to do the best for their patients. But if you get to know that research is doubling every 9 years, right now, medicine has 24 million publications, when an average human being can read around 250 per year. On the other side, this is just 1/3 of a patient's medical record, and it's insanely growing with a lot of parameters. I'm talking about genetics, lab reports, MRIs, CT scans. It's just incredibly hard for one human being to sit in the middle, try to make the inferences between, and recommend the treatment for you all in 20 minutes. It's incredible. It just can't. Now, the problem is that not only is he not able to make the inferences, but the decisions that are made based on what I, as a physician, happened to know, rather than the collective knowledge of what we as humans know today. What if we replace the doctor? As a matter of fact, what if we augment the doctor with a super processing power, super memory, something that can read research, that can understand medical records, that can make inferences between both of it, and at the same time, it doesn't sleep, it doesn't go to the bathroom, it's just continuously matching a patient to the breakthrough treatments. I mean, if something comes in tomorrow that matches my patient, I'm gonna be the first one to know that. If I'm, as a patient, get something in 2 weeks later that's gonna match my case, I deserve to be the first one to know that. This is Mendel AI. Mendel AI is a frictionless website. You log into the website. All what you need to do is you upload your medical records. If you don't have it, we can request those records for you. Once we have the records, we analyze this data against a database of almost every breakthrough treatment or clinical trial that is existent right now. And then you get a list of all the treatments with a match score that tells you how much is this treatment matching to your very specific case. Now, this is not to tell you this is the best treatment for you, but this is to give you, as a doctor or as a patient, a tool to start better and more smart conversations, and that is why patients get to have different content than doctors. We add videos, we change the language, we basically turn the treatment protocols in something that the patient can understand, while doctors get more scientific stuff. Now, I think everyone thinks this is super logic, like, this is an obvious problem. Definitely technology should be there right now. Why nobody else is doing that? Well, the reason is AI right now in medicine is more NLP-based, natural language processing. Think of yourself talking to Siri. We can understand research, we can understand medical records using the AI, but when it comes to making inferences between both of them, AI can't do that. What we do is we build human rules. A human being basically sits down and starts identifying if this happens and this happens, then this is a match or not. The problem is it's easy when you can do 1 rule, 2 rules, but medicine needs millions of these rules. And there's no AI, there's no human being that can sit down and do that. Well, the insight that we in Mendel have is, what if we teach this AI to basically start building its own rules? So I teamed up with my co-founder. one of the best data scientists. They've been working on data for the last, clinical data for the last 6 years. And we decided to take one technology that nobody thought it has an application in healthcare and customize it with domain expertise so that it can start building its own roots. This wasn't as easy, because after building this technology, now you have to take it to med school. So we trained it with over 3,000 hours and over 80,000 training examples done by physicians. Not only that, every time we get a patient and the AI kind of gives a recommendation, one of our physicians sits down and corrects the AI, so it's a back loop. Think of it, we're having a kid, every time we get a piece of data, it's getting smarter and smarter and smarter. But it was often a good start with over 80,000 training examples. Now, having a great technology in healthcare is one thing, but breaking the gridlock where patients do not trust new companies, they do not trust startups, they don't want to share their data with anyone, and on the other side, you have doctors who are reluctant to adopt any new technology. It's hard. So we didn't want to just build the website. We have the website, but we didn't want to just stop there. We built an API that can basically allow us to go to patients and doctors where they are already congregating. So if a doctor is sitting in front of an EMR and he gets a notification about one patient being matched to a treatment, this is Mendel working in the background. If a patient calls the American Cancer Society on the phone asking for a clinical trial, it used to take 7 days for an agent to answer this call. Now, in a minute, this patient can start recommending treatments using Mendel AI. This allows a frictionless interaction with our technology and allowed us to build the network effect. So in 1 month, by partnering with 2 organizations, one like an NGO organization, LLS, and another diagnostic lab like CGI, we're on a start to start matching over 30,000 patients, and I'm talking about 1 month worth of sales. Now, I think every investor in this room now wants to know, how do you guys make money? Well, if the patient calls a non-governmental organization or non-profit institution and they're using our API, we do not charge them. But if this patient decides, well, I need to have continuous matching, which basically means every time there's something that's matching my case, I need to know about it, we charge them a subscription fee. Actually, we have a lot of patients who are cancer-free, but they give us their medical records because they want to have a plan B if things went south. On the other side, if a diagnostic lab or an EMR integrates our services, we charge them $1 per API call. This part of the business is to pay the bills and to keep the lights on. We funnel this data into a database that can be monetized by working with pharma companies, giving them access to this data so that they can basically identify new biomarkers. They can also recruit patients for clinical trials and develop better treatments, which is at the end of the day in the favor of the patient. Now, this can build a sustainable business. This can build value to shareholders because it's a $24 billion market. Today, medicine is all about biomarkers. Medicine is about, if you have lung cancer, that means nothing. What kind of mutation you have? So we need those biomarkers. Think of it like 23andMe. When you guys send a kid there, they don't make as much money doing the analysis. What they really make money off is using this data with pharma companies to come up with better treatments. So for instance, last year, Roche got access to 3,000 data points from 23andMe, and this sale alone went over $60 million. Now, on the other side, the clinical trial recruitment and the search averages on $2 billion also, which is not a bad market to kind of keep the business going. This is my favorite slide. Technology is it's a lure. It's something that people love to hear about. But getting patients and getting people to actually engage with this technology is a very rare thing. So the real competition, I can talk about our technology and how superior it is than anyone else in the market right now, but I think that our real competitive edge is the philosophy which Mendel is based on. We are building a superior technology for not superior hospitals or superior doctors who are already smart. We're building it for every patient or doctor who have internet access, whether it's in the US, Mexico, Egypt, some random jungle in Africa, I don't care. As long as they have internet access, they deserve to know what is the best and the latest treatment for their cancer. Now, this was only doable when we decided to take the step of engaging patients on a sentimental level and reformatting the content. We have algorithms literally to just reformat the content for patients. We also took the step of saying, you know what, we're not going to be one silo. We are open for any company or any organization so that they integrate our API on it. We also built a technology that can scale. Almost every investor in this room got to know about this company building an AI for this, an AI for that, but we actually have an AI. The other thing is, this technology, along with what we did, allowed us to be on a good start for a network effect, which is the real defensibility of our technology, the real defensibility of our product. I'm supposed to talk about how my engineers and team are rock stars. They went to the school and they did that. Well, they did all of that. But I want to thank every single person in my team, because they were crazy enough and audacious to take one technology that nobody thought it can be applied in healthcare. It was basically more for images and videos, and made it happen in 4 months and made patients able to now access treatments. So in 4 months, we went from 0 to having a technology that is working. We were able to get traction. We were able to make this happen. And for that, I'm very thankful for every one of them. And trust me, they are rockstar engineers. Well, at the moment, we are matching patients to clinical trials, and we want to move to matching them to other treatments, maybe approved drugs or guidelines. What I mean by guidelines is, it's a well-known fact, if the patient is an old age and has multiple myeloma, he should not consider a bone marrow transplant. Well, research says now that there's some criteria, if the patient matches, he can get the bone marrow transplant. So we are working on the direction of having a Jarvis where you can ask, can my patient get Medicare bone marrow transplant? We use the medical records and give you an answer. And this is our next step. For that, we need $2 million. And just today in the morning, we got a commitment for the biggest chunk of it with some of the most strategic partners in the Valley who can allow us get to the network critical mass faster than what we expected. Thank you, and I hope to see you soon. But one last thought. I think everyone in this room knows or lost someone for cancer. So this is not a startup. This is the difference between life and death, because we don't know who is the next patient. Thank you so much.